Welcome to another episode of Clear Lake Connections, where we talk to the people behind the businesses of Bay Area Houston, proudly sponsored by UTMB Health. Today's special guest is Todd Caliva. You're with HCA. Tell us about HCA and what you've got going on over there.
Yeah, thank you, Jameson. I appreciate you inviting me on. A lot of exciting things. So HCA Houston Healthcare Clear Lake is a part of the healthcare company HCA. We're the largest hospital company in the world with over 184 hospitals, I believe, the latest count. And we're part of the Gulf Coast Division, which is 13 hospitals here in Houston and 3 hospitals in South Texas. Those are all the acute hospitals. And then we have a couple of post-acute facilities that round out the division. But Clear Lake's the flagship. We're over 532 beds. We employ over 2,400 employees right here in Webster. And just couldn't be more proud to be a part of the Clear Lake family. It's been incredible for me. I'm a native Houstonian, so born and raised. And I'm celebrating my 32nd year with HCA this year, and all in Houston. So part of my professional goal and dream was maybe one day I could go back to Clear Lake to be the CEO. And 8 years ago that happened, and I've been back at our flagship for 8 years. And just to see the incredible growth that's going on in Clear Lake is just in the surrounding area, right? I mean, we're in a hyper-growth area, 13.5% growth rate. People are flooding into Texas, and they're flooding into Houston, and businesses are flooding in. And with the demand of healthcare is going to continue. And as people flood in, we want to make sure that we're here to meet the ever-growing demands of healthcare. And so we've really focused on our access points. We now not only have the hospital, but we have Mainland Medical Center, which is under our Clear Lake license, so it's under one license. Then we have 4 freestanding emergency rooms. You've seen the proliferation of freestanding emergency rooms, and I'm super proud that we have 4. I think the big difference to note from a privately owned freestanding emergency room and a system-owned freestanding emergency room is that the system-owned freestanding emergency rooms operate as if they were part of the hospital. So they're in network. They take your insurance. You don't get these huge, outrageous bills because they're out of network. The private freestandings are out of network. They don't take insurance. They just bill your insurance for bill charges. So we're super happy as we've grown. We have 4 now, one in Pearland, one in Friendswood, one in Texas City, and one in Alvin. So, and then we have 3 urgent care centers, Care Now. Many of people have heard of Care Now. That's owned by HCA. And we have 3 Care Nows as well, Friendswood and Pearland, and then we have one in League City on 646 in the freeway. And, you know, we want to make it easier for people to access healthcare. And I believe that as our city has grown, we now have 8 million people in the city, and there's traffic now officially 24 hours a day. You know, once upon a time, I remember when you just stayed off the roads around 7 in the morning and 4:30 in the afternoon. Well, now it's traffic all day. And people don't want to drive into the medical center. They want to stay close to home to receive their health care. So,
Yeah, you guys have really made that very available to people. And I think that's that kind of a newer model of healthcare.
we've made a huge investment. The company's invested $400 million in our hospital. We're just about to announce a $105 million expansion project as well, as soon as it gets final approval. So just a lot of growth going on so that we can meet the demands and the needs. And the really interesting thing from my perspective, and the thing that I'm really, really proud of, is that the acuity of what we're doing. I mean, we're a level 2 trauma center. We're a comprehensive stroke hospital. We're a level 3 NICU. So we take care of the sickest of the sick. We will be kicking off a big GME program in June, which will have 25 internal medicine residents. And by 2028, we'll have over 230 residents on campus, which I was told will be one of the largest single hospital GME providers in the country. And then when you look at the heart hospital across the street, it's a 154-bed heart hospital. And, I mean, we've done some amazing things. On the CV side, we just got recognition a couple of months ago to be in a 3-star STS program. That's the Society for Thoracic Surgery. It's like the most esteemed award you can get in the CV circles by the Society of Thoracic Surgery. And there's only like 5% of the programs in America have 3-star recognition. None in Houston. We were the first in Houston to have 3-star recognition. I think the last 3-star program was like 6 years ago. So if you think about it, to be in the TMC, the Texas Medical Center, the city of the largest healthcare medical center in the world, and to be the only 3-star program makes us all super, super proud. So we celebrated that. I think it's important.
Yeah. Talk to me about the culture at HCA. You guys seem to be really community focused. I know you serve on several boards, are very active in the community. You have a great partnership with Clear Creek ISD where you give kids basically on-the-job training and then pay for their schooling after that. Talk to me about the commitment you guys make like that.
Well, it's intentional, right? I mean, it's not accident. It's very intentional by the company to be super, super involved in our communities and be stewards of our own time and talents and be involved. All of my senior team is on a board, whether it's a chamber board or a non-for-profit board. We're a community hospital, and it's important for us to be all very, very involved. We track our community hours. That's part of the company's initiative for all leaders, track your community hours. And a lot of leaders have their goal. One of their goals that they put, we have 5 goals that we put down, and a lot of it is around a community service goal that you'll put down. And it's like 25 hours a year of community service. We track it. We encourage it. We model it from all of us as senior leaders that community impact is really, really important. We announced this year a couple of months ago, and there was a news story that we have done a partnership with the Barbra Bush Literacy Foundation, and that's a big non-for-profit where every mom that delivers a baby in our hospital and HCA West Houston, and shortly at Women's it will begin, gets a new book to read. They get a book. They're given a book just because of the incredible statistics that are around childhood literacy.
Yeah.
And when you read to your child from ages 0 to 3 is where the most impact happens. And I got to know Julie Baker Fink is the president of the Barbra Bush Literacy Foundation, and she was on my board when I was at West Houston, and I got to learn all of this. And I just really felt passion of educating our community of how important that is, because a lot of young moms don't realize that these first 3 years, and the statistics are out there. I mean, it's not like guesswork. It's there. If you read to your child from 0 to 3, their chances of going through high school and college go up by tenfold. It's crazy the statistics. So we're going to do our part in the community. So we started November. Every mom that delivers a baby gets a welcome packet, gets access to the Houston Community Library. They get a new book. And we're just making sure we can do our part for our community and for our young moms.
Talk about the changes you've seen over. I guess you've been in Clear Lake 8 years now. Mm-hmm. The kind of competitive nature of healthcare, but yet somehow it's. I think there's still a lot of collaboration there as well.
Yeah. Well, I mean, look, it's competitive, but in healthcare, we're all there for a common cause, right? To make life better for our patients. And I have a tremendous amount of respect for all of my healthcare competitors that do the same thing that I do each and every day, which is you wake up and your goal is to make life better for our patients. And our mission statement at HCA is, above all else, we are committed to the care and improvement of human life. And that's truly what we do each and every day. So I have a lot of respect. I mean, a lot of competition in this area of town, right? We have 5, 6 hospitals, 7 hospitals. And as the demands of this area, and I always classify our area, the southeast part of the city is a couple of million people. Mm-hmm. If you go from 288 all the way to Baytown, it's bigger than most cities in the United States. So there's a lot of patients, and I think they can support all of our healthcare partners. But I'm a believer in competition. It keeps us all on our toes and keeps us all driving to be better. And in healthcare, that's really, really important. Yeah. And we're all trying to deliver world-class healthcare to our community.
Talk to me, though, about how you're retaining and attracting talent, because we through the BayHep, we interviewed all the local medical facilities, and just the struggle is...
Well, when it becomes really tough and you're in super competitive markets, we do a great job with our culture. Clear Lake was the for the last 2 out of 3 years, we had the highest employee engagement score in the entire company for all the large facilities, which I call the monster facilities. There's like 30 of them that are 500 bed and above. And we were number 1, and then last year we dropped to number 2. So we're still super high. We have great employee engagement, great culture to ensure that we can attract and retain the best and brightest. However, what happens when you're in a market like this, it gets very difficult, and there's a shortage. So you have a shortage of manpower that we've seen in nursing and different subspecialties in the labor force, and people are throwing a lot of money at these employees. And you can't just get into a wage war because you'll bankrupt your institution. Healthcare, it's not sustainable. So we've done very strategic things with HCA and being a part of the largest healthcare company in the world. We have a nursing school. We've partnered with many colleges. We have partnered with many high schools. We're now into GME to help recruit doctors. But we have nursing students that rotate through our hospital. The dean of the HCA Nursing School, Dean Tart, the chancellor of University of Houston, the president of the University of Houston Clear Lake, Dr. Richard Walker is on our board, and then Dean Tart from University of Houston Nursing School is on our board, and then Brenda Hellier, the chancellor of the San Jacinto, is on our board, and we get students that rotate from all of those schools. So you got to partner with the community, especially from a labor standpoint. Brenda and I have worked together on some different programs when we were struggling with ultrasound techs. Why don't we have better schools to promote to high school students and to college students ultrasound techs? They do very well.
Sanjak's very nimble.
Yeah, they're very
great
nimble.
to partner with.
Sanjak has been an awesome partner. U of H Clear Lake has been an awesome partner. And then U of H with Dean Tart's been awesome. So, pretty awesome when local businesses work together and collaborate to address the different needs of each other, to see how people can collaborate and solve problems makes you really proud.
Yeah. So talk to me maybe a little bit about your career, and because I think when people think about hospitals and the medical field, it's always doctors, nurses, but there's a wide range of positions available.
Oh my God, it's incredible. When I started going out to high schools, 8th, 9th, 10th, 11th, and 12th grade, and thinking about healthcare as a profession, as a career. Every time when kids in 8th and 9th and 10th grade think about healthcare, they think about being a doctor or a nurse, right? I mean, we have engineers that spend the night in our hospital every night. We have plumbers, we have electricians, you have ultrasound techs, you have radiology techs. I mean, the field is vast. IT people, finance, accountants, everything is in our hospitals every single day, but people don't normally think of that.
Yeah.
And what I wanted to point out to people is that, we grew up from our parents telling us, pick a profession that you love, and then you'll never work a day in your life, right? If you pick something that you have passion for and you love. And that's not always easy to do. But for me, what was easy, and I always knew I was going to work really hard, I just wanted to feel a lot of passion for what I did. And healthcare came to me, like it does for most people, from a very personal experience. My mom got diagnosed with cancer in 1989. I was 19 years old. And it's devastating news for a 19-year-old who's never even had any kind of interactions with a hospital. So for that year, it was a very aggressive cancer, and she lasted for like 11 months. I got a lot of interaction with hospitals and nurses putting their hand on your leg, assuring you that it was going to be okay, and they knew you were scared. They knew you had questions. So I knew I wanted to do something with healthcare. Didn't know what at the time, but I knew I wanted to do something in healthcare because I saw how that impacted my own life. So that's where the decision for me was healthcare. Yeah. Well, that's what I tell a lot of students, is that just because you're not a doctor or nurse doesn't mean that you can't be a part of healthcare, right?
It takes an entire team to provide care.
The story that we always hear about President John Kennedy when he visited NASA, and they were touring through NASA, and he asked the guy that was sweeping the floor, "Hey, what do you do?" And he said, "I'm helping put a man on the moon." It's kind of like that. Yeah. Everybody plays a part in healthcare. The people who sweep our floors, the people who do terminal cleans in our ORs, the nurses, the doctors, the ultrasound techs, the radiology technicians, the cath lab technicians. Everybody plays a part. And if you like the idea of what your career does, is we impact people's life who are at most times in their most vulnerable state. They're sick. Nobody wakes up in the morning and says, hey, I think I'm going to go hang out at the hospital today. They're there because they need us. And it's people who feel passionate about making life better for people, who really fit in nice to healthcare. People who have a servant's heart, people who are givers, people who are servant mentality, service-oriented, who want to serve. Those are usually the best healthcare professionals, whatever you do, doctor, nurse, whatever. So
It's a good mission to get behind.
Great mission.
Yeah.
Great mission. And unfortunately, we're going to all need it at some point in time.
Yeah. Well, it's no law of diminishing returns there. It's constant. So, but
Correct.
Speaking of that, what are you seeing right now with the aging population? I mean, that is it. Are you on a trajectory of like exponential
Demand's going
growth?
up. Well, because you have people living longer, right? So you're seeing a couple of things. You're seeing people living longer. You're seeing, I think some of the statistics I've heard on the healthcare spend, because when you look at how much healthcare has gone up, the cost of healthcare, it's crazy. But you hear a different statistic every day on the healthcare dollar. Like I've heard latest, like 75 or 80% of the healthcare dollar is spent in the last 6 months of life. Those are some numbers that get thrown out, right? Which tells you that people are pumping tons and tons of money into life feudal type care. And that's something that we as a country are going to have to get behind to just educate people. As family members, we all want to do everything we can for our loved ones instead of having open and honest conversations with them about, we're going to all get to an end of life situation, right? That's inevitable for all of us. And I think more education you can give for people to let them be surrounded in comfort without pain and with loved ones, that's just a stage we're going to all get to, instead of just doing the $1 million workups and all of the stuff that's getting done. So I see a little bit of that in the as we're having to deal with the aging population. Also seeing, people are living longer because they're being healthier and they're working out more. So we're seeing the demand for orthopedics go up, right? With total joint surgery, knees, hips, shoulders, because people are playing tennis longer, people are playing golf longer, people are running and jogging. So you're seeing orthopedics demand go up just because people are living longer and being a lot more active. I think as we see the aging population go up, you're going to see more healthcare companies who are more aware of dealing with an elderly population from in their own facilities, right? Like how we handle for the elderly. There's some hospitals that even have ACE units, acute care for the elderly, and different types of things that they've done where up on those floors you have the letters that are larger and the phones that are larger, so it's a little more visible. So people are doing different things to ensure that we can care for that population. But I think you're going to continue to see the demand as people live longer. There's more people in our area,
and I think you're right that kind of conversation has to happen at a national level, because I think
for sure.
Other countries are probably a lot better at dealing with that end of life.
Well, we tend to politicize everything, right? We politicize everything when in reality this is a conversation that it starts with knowledge is power. And if we start educating people, this is not about cutting off care for someone and letting them die at all. This is understanding what end of life means and are we there, and then how best give the patient the dignity and respect that they deserve. When certain people have stage 4 cancer that spread throughout the body and there's 2, 3, 4 months, let them live those 2 or 3, 4 months with dignity, without pain, and spend the most valuable time with their family versus having the family, want to throw everything you possibly can from a treatment standpoint, when there's not really treatment options at that standpoint other than you can continue to run up healthcare bills. But it's a lot of it is with education. Just educating and equipping people with knowledge, I think, is important. And we're going to have that at the national level.
So it sounds like that would be one way to maybe drive down the cost of healthcare a little bit if we could have those honest conversations. What are some other areas where it looks like maybe we could save some money when it comes to healthcare?
Well, I think if people access is the most important thing, making sure that people have adequate access to healthcare. If you get a really bad cough that's getting deeper into your chest, and you can go to the primary care doctor or urgent care center and get a dose of antibiotics on in 7 days, you're good to go, versus you ignore it and it gets worse and turns into pneumonia. And next thing you know, you're in my ICU and you generate a $150,000 bill in my ICU when that could have been eliminated if you went to the doctor when you first
$10 copay. Yeah.
Right, with a $10 copay. That's the biggest thing, I think, for people, is having adequate access, that they can get to a doctor. And some people can't get to them until you have to call 911 and you come in an ambulance, right? If you get low symptoms of chest pain, we all get some kind of form of chest pain. But you got to get your annual physical, right? Good preventative medicine is really, really important. And getting your stress test done to know what's real chest pain and what's anxiety is really important, so that if you go early and they can do a cardiac cath on you and find out that you have a blockage, and you get that taken care of, versus having a massive heart attack and being in the ICU for 3 months and recovering and then rehab and everything else, and you have $1 million bill versus a $30,000 bill. Preventative measures are really, really important, and that's again with education.
Yeah. Well, I appreciate you coming on, and thanks for all you're doing in the community.
Yeah, thank you. I really appreciate it, and this is one of the most vibrant communities in the world. I really believe that. This is nothing better, and to see our growth makes me super, super proud. So thanks for all y'all support.